You may have seen TV ads or even some sort of advertisement at your local drugstore for a vaccine for shingles. But what exactly is shingles and who gets shingles? We're going to find that out in this segment right now. We're talking with Dr. Gregory. She's an internist and pediatrician with the Siloam Family Health Center. We're so glad to have you on here today.
Thank you for
Thanks for being
having me.
with us. I guess maybe define what shingles is for folks out there who don't know. A lot of people, though, you're hearing, like I said, a lot more about it and obviously seeing the vaccination advertisements. But tell us a little bit about the actual, condition itself.
Sure. Well, shingles is a condition that's characterized usually by a rash. That's what people usually think about when they think about shingles. But it's a segmental rash, usually on one half of the body.
Okay.
Typically, it will begin with some pain or tingling in that area and then followed a few days later by a blister-like rash in a little cluster form. Sometimes those will then ulcerate and crust over.
Goodness. Does it spread or does it stay within one certain area of your body?
Well, because of the cause of shingles, it descends down a nerve, and so it will stay in that pattern of the nerve distribution.
Okay, let's talk about the cause of shingles. What exactly does cause shingles?
Well, many of you have heard of chickenpox. The same virus, varicella, that causes chickenpox causes shingles as well.
All right, so if you were somebody who had chickenpox when you were younger, you're more susceptible then to getting shingles as you age, correct?
Well, really, if you have not had chickenpox, you can't get shingles in older age or when your immune system is down. But people may have had chickenpox and not even realized it. Sometimes it's a really mild rash.
Sure.
So most people shouldn't assume that they're not susceptible to getting shingles.
The good thing is, though, there are immunizations for that. And for chickenpox, too. So we should probably mention that. Both of these came out at different times. Tell us, Dr. Gregory, when both vaccines came out and who could be a candidate to receive those vaccines.
Sure. Well, the varicella vaccine, which is the chickenpox vaccine, came out in 1995 in the U.S. It's given at ages 1 and 5 and is very highly successful at preventing chickenpox, about 90% successful at preventing chickenpox.
Okay, if you're older and you didn't have chickenpox, can you still get the vaccine? So I'm 30 years old and I've never had it, and I want to say I don't want shingles either. I'll get one or the other. So I imagine you get the chickenpox vaccine, correct?
Well, really, in that case, you should discuss with your doctor about getting titers drawn to see if you've had chickenpox or about getting the vaccination.
Okay.
And even in that case, go ahead and get the shingles vaccine after age 60 to prevent, in the case of the immune system being compromised or a period of high stress. Even old age can make the immune system wax and wane a little bit.
Sure.
And make more susceptible to shingles.
Okay, you had mentioned the vaccine when it came out for chickenpox in 1995. Talk a little bit, too, about the vaccine now for shingles, when it came to be, and who should be lining up and getting that shot.
Sure. The shingles vaccine came out in the U.S. around 2006, so more recently. And the CDC recommends anyone over 60 go ahead and get that vaccine. Even if they've already had the shingles before, it's recommended that they get it.
Okay, and why that age? I'm curious to know, obviously shingles comes about later on in life, but why is that? Is it because your body is changing so much and because of that shift and change, that's when things like this present themselves, or why is it?
Well, part of it's the time that has lapsed since the exposure to that virus.
I see.
But also with age, as a lot of things change, the immune system also can be a little bit weaker. People who are experiencing very high stress, illness, or using medications that may compromise their immune system would also need to be very cautious about shingles. So it wouldn't just be older adults who would need to worry about it, also people under those conditions.
Okay, is shingles contagious?
Well, that's a tough question to answer because it depends on who's being exposed. So the virus itself, varicella, is highly contagious, which is why when we were children, everyone in a classroom at some point got chickenpox if they were exposed. However, in the case of shingles, it's not possible to contract shingles from being exposed to someone with shingles. So let me explain a little bit.
Okay.
If someone who had never had chickenpox before were exposed to someone with shingles, they wouldn't get shingles, but they would likely get chicken pox from that case.
Goodness. Even depending on age, or no? Like I said, I mean, if they were 60 and up, they wouldn't get shingles, they'd still get chicken pox, huh?
If they had never had the vaccine and never had chicken pox before, they would.
How interesting. And I will say this as far as my mom's concerned. I have two older sisters. She had us all kind of in the same room at the same time thinking, well, if one has it, they might as well all get it. But that's probably not ideal way of thinking. Or what would you recommend in terms of if you have several children and there is a case of chickenpox in your family, what do you do?
Well, thankfully, since we have the vaccination now, most children, even if they are exposed to chickenpox, will not contract it now.
Okay.
Caution should be taken in cases where there is an infant in the house, because the vaccine cannot be given until the child is 1 year old. And then in the case where there would be a pregnant woman exposed, especially a case where she has never had chickenpox or the vaccination before, that would be dangerous, because the virus can pass to the baby.
Transmit to the baby. That's good to know. If somebody thinks to themselves, I may have shingles, or I'm getting some of the symptoms that you had talked about, at what point do they pick up the phone and call their doctor or an internist and say, may I come see you? This seems like it might be something more than just a little rash.
Well, I would say right away.
Okay.
Because if it's not shingles, needs to be figured out anyway.
Sure.
If it is shingles, there's treatment for it. So antiviral medicines are used to treat and shorten the course and lessen the symptoms. And the antiviral medicines can also decrease the likelihood of complications of shingles.
I was going to ask you, as far as treatment's concerned, is it topical? Is it a medication that you take by mouth?
It's a pill.
Okay, it is a pill. And how long are you taking this type of treatment if you are diagnosed with shingles?
Well, the doctor would need to determine what the best medicine is. There are several different choices for the antiviral medicine that would be taken. So depending on insurance and cost and other medicines you might be on, it could be different for other people.
Okay, and how long does shingles typically last in terms of it being in your body and you having to deal with this?
That's another one that really depends on the person. Some people are going to experience just a short period of that rash, the burning pain, and it's going to go away even within a couple weeks. And some people may experience that pain as post-herpetic neuralgia, a fancy way of saying a prolonged pain syndrome after the shingles, which is one of the major complications of shingles and why it's really important to be vaccinated and treated.
But much like chickenpox, when you have shingles, don't go to work. I guess you need to steer clear of people, not going to church and things like that, just so that you don't expose others. Is that correct?
Well, really, if it's covered and it's not
and you're being treated, I suppose?
And being treated, and you're not going to a place where you're going to be exposing infants, pregnant women, people with compromised immune system, or working in a nursing home, something of that sort. If you can keep it covered where it's not exposing anyone to it, it's something to discuss with your doctor, but it's possible that you could still work.
Okay, and for folks out there who might want to know, if they had a bad case of chickenpox when they were younger, would they then have a bad case of shingles?
Not necessarily.
Okay, that's good to know. Any other tips that you can suggest, or a good piece of advice you can give folks out there who want to know more about shingles?
Well, just remember, if you do have the shingles, it's important to be evaluated quickly so treatment can occur. Occasionally, those blisters that crust over can become infected then with bacteria, so it's important to keep them clean and dry to make sure someone's seen it and is monitoring it, especially if it's an area on the back where you can't see yourself. And then be very cautious about exposing others.
Sure, all great information. All right, Dr. Kat Gregory, who is an internist again and pediatrician over at the Siloam Family Health Center, we appreciate your time. So good to visit with you.
You too.